Hello, I'm Linda Pfeiffer from InMed Partnerships for Children. Since 1986, InMed has worked worldwide to create pathways for disadvantaged children and families to achieve well-being and self-reliance. Our newest program is a Transition to Scale initiative, introducing a suite of innovations to transform neonatal jaundice management, starting in Peru. Jaundice is the most common condition requiring medical attention in newborns. Severe neonatal jaundice can cause permanent neurological damage and even death. Yet babies go unscreened and untreated for lack of accessible methods and equipment. In Peru, more than 90% of public health facilities lack the capability to adequately diagnose and treat jaundice. This contributes to a rate of kernicterus, a type of jaundice-linked brain damage that's up to 20 times greater than in high-income countries. We have a solution to overcome these disparities. It's called the Bilikit, and it's a game changer. It contains 3 technologies, each of which fills a critical need in low-resource environments at each step of the clinical pathway. First, there's the Bili Ruler, a digitally calibrated color matching tool to facilitate broad screening of newborns at the time of peak jaundice, which is shortly after birth. Then the Bili Stick, a handheld device for quantitative point-of-care jaundice diagnosis with a single drop of blood, a pinprick. And the Bili Hut, a uniquely portable, battery-capable, high-intensity phototherapy device that makes jaundice treatment possible even in the most remote areas. The Bili Hut was developed by one of our program partners, Little Sparrows Technologies, and they won multiple awards for innovation, including earlier this year, the Patents for Humanity Award. Each of the Bilikit's technologies has been individually validated in developing countries with sensitivity, specificity, predictive value, accuracy, and therapeutic equivalence comparable to traditional devices, which are far more expensive and less accessible. So bringing together these components in a kit creates an integrated, simplified approach that doesn't exist in Peru nor in many developing countries. That's why the Bilikit is transformational for evidence-based care. Neonatal jaundice requires a fairly complex sequence of screening, diagnostic, and treatment events to occur in a short time frame to prevent irreversible progression of neurologic injury. To deploy these technologies, InMed, with our Peruvian affiliate, InMed Andes, is leveraging our existing partnerships with public health networks and officials at the local, regional, and national levels in Peru. We bring together community health agents, healthcare professionals, and government systems to establish an integrated approach to neonatal jaundice management. Our approach to deploying the Bilikit is threefold. First, introducing these context-appropriate technologies, and then improving service delivery of jaundice care, and also increasing knowledge of and generating demand for improved neonatal jaundice management. As we deploy each of these technologies in the target communities, which we've identified, by the way, by both elevated rates of kernicterus and institutional needs, we'll implement a quasi-experimental evaluation design, including comparison areas. And along the way, we'll measure not only basic process and outcome indicators, but also detailed newborn health and treatment outcomes and cost-effectiveness data. And we'll document acceptance of the technologies among the end users. Our Saving Lives at Birth initiative was one of 4 projects selected in 2018 among nearly 500 submitted, with a 2-year, $800,000 contract with Grand Challenges Canada. We're launching the Bilikit in Peru in early 2019. Now, why am I presenting this? InMed is seeking funding partners to help us fulfill the required one-to-one match to our Grand Challenges grant, and we're also seeking expert advice. InMed has worked at international health for more than 30 years, and in Peru since 2003, and we have the public health sector connections. But we also are looking for guidance on building on the evidence generated in this project to inform and advance our longer-term marketing and scaling plan, first within Peru and then beyond. Thank you.